So we are looking at what medical treatments or medical treatments for what amoebiasis. But you're also looking at what the drugs, okay, possible drugs that can be used to what treat this what intestinal infection that can also go to affect your liver, go to affect your lungs, go to affect your brain. Okay, so he said that this type of disease condition is caused by the organism known as what Entamoeba histolytica. So because it is caused by this Entamoeba histolytica, which is a parasite. Now most of the drugs you are using are basically what antiparasitic. Okay, so let's have it. We said that what medical treatments for amoebiasis is what typically involves the use of medications, and you are using these medications to eliminate the parasites from the body. That's why I told you guys that what it's basically trying to fight against all this stage that the parasite is cysted, when the parasite is what existed, okay, and all of that. You understand? You are just trying to eliminate the parasites from the body. So the medications are known as what anti-parasitic medications. So the choice of medications actually depend on the severity of the infection, how far the infection has actually affected that individual. Okay, so it also depends on the location of the infection. It also depends on how strong the patient is to be able to carry that kind of drug in their system. Okay, so what are the possible drugs you can use for what amoebiasis? You can use drugs like what metronidazole, also known as what Flagyl. So metronidazole is what effective against trophozoites. That's basically what when the parasite gets excisted, that comes out of the cyst and becomes active, it is known as a trophozoite. So a Flagyl or metronidazole is active against this what stage. Okay. Then also what? Okay, it's active against the active form and also what the form that is in the cyst. That's a dormant form. Okay, so it's actually an all-round drug. So tinidazole, also known as what Tindamax, is an alternative to metronidazole and is effective against what trophozoites and cysts. The Paromomycin, also known as what humatin, it is effective against what cysts used for what as used for asymptomatic carriers. This is basically people that what the disease condition has not start causing great symptoms. Okay, so at the early stage you can treat it what Paromomycin. Okay, then we have what indoquinol is effective against what cysts used for what asymptomatic carriers or mild intestinal infections. Then chloroquine may be used in combination with other medications for what severe cases. Okay, so there are surgical treatments. This one is basically the medical treatment. Okay, like drugs options for treating amoebiasis. Okay, so what are the treatment regimens? If there is mild intestinal infection, metronidazole or tinidazole can be used for like 7 to 10 days and can actually clear up the problem. If there's severe intestinal infections, metronidazole or tinidazole can be used for like 10 to 14 days, okay? Followed by paromomycin or indoquinol for 7 to 10 days. Then if there's extraintestinal infection means that, okay, from the intestine, it's leaving the intestine to affect the liver, affect the lungs, go and affect the brain. Okay, so there's extraintestinal infections. You can use what metronidazole, tinidazole for about 10 to 14 days, followed by paromomycin or indoquinol for 7 to 10 days. Okay, then if it's asymptomatic, you can use paromomycin or indoquinol for about 7 to 10 days. Okay, so I think that's it for the medical treatment for amoebiasis.